So close, so intimate, so tightly wrapped. We've got to do this surgery very precisely, very precise surgery, or else you'll be scarred for life. And we wouldn't want that, would we? No, we wouldn't want that. Hold still. Hold still. I'll be as gentle as I can. But since you're allergic to anesthesia, you'll have to do the procedure awake. We've numbed you. We've used the numbing agent to immobilize you. I can't promise you won't feel anything. I can't. But I'll try to be fast. There's a lot of cutting away to do. Hold still so I can do an exam. Hold very still. Right about there. Okay, let me look. Okay. I have to get very close. I know you understand. I have to get very close. Very, very, very close. Gotta get in there very, very close. Also, gotta get in there very, very, very close. Very close. Very close. Very, very close. Very, very close. So intimate. So much personal space is completely violated. Totally violated. Much to your chagrin, I'm sure. Much to your chagrin, I'm sure. I'll take that sample. Now we've got to get in behind the eye. We've got to penetrate and get behind the eye and look around the eye. Penetrate it and get behind it. We've got to check around the rim of the eye, the rim, the subtle boundary between the flesh, the skin, and the eye. The eye needs examined completely. So tight. Such a good seal. The moisture between the eyeball and the socket forms a perfect seal to keep out dust and dirt, doesn't it? Such a tiny little light. Looks so bright when it's right in front of your eye, brighter than the sun, isn't it? You're doing so well. You're doing absolutely perfect. Absolutely perfect. I think I need to cut right there around that seam to loosen up the skin of the eye. Hand me a scalpel. What? You can't move. You can't move. The only one in the room who's in their right mind. Well, hold on if you're worried. I can pull back. I can pull back the skin around the eye lid as I cut. As I get in there and do my slice, my little slice. Just hold it. Hold it. See? That's it. One little prick. And it's all over. Now, I must get in there. Use a little more numbing agent on you. Just a little more numbing agent. Just to numb the eye. Just a wee bit more. Just a little more. Just a few milligrams. Hold still. Hold very, very still. Don't worry, this numbing agent works wonderful. Wonderfully. Oh, it's so hallucinating. So illuminating how well it works. And we must endeavor to silence the pain in your eye before we cut it a little more with this fine blade. This is the fine tipped blade. Before we cut any more, I must add some moisture to your eye. You need a little moisture. Get a good mix. Just isn't quite there yet. Gotta keep the eye moist. The moisture level must be attained. Or when the knife goes in, if it's too dry, the knife will cut too deeply and might rupture a corpuscle, a blood corpuscle, and then you'll bleed. And then we'll have to get these little swabs and dry up the blood. And we wouldn't want that, would we? Not for such a minor surgery like this. No. We don't want to open any blood corpuscles. Let's get some moisture in that eye. plastic surgery patient. You're gonna have sexy Betty Davis eyes when we're done. Greta Garbo, stand on the side. She's got Betty Davis eyes. I'm sure. Aren't you? I'm sure. Now your eyes are moist. With the elixir that I used, I want to get in and do a very fine cut on your eyelid. I want to get in there and do a very fine cut. Very fine. Very tight. Hold still. There it is. Right there. Oh, oh. Good. Good. Perfect. A perfect cut. The most perfect of cuts. It really was. A perfect cut. I think we're almost there. Aren't you happy? I know I am. So let's endeavor to proceed. Now we need to use a hot needle to cauterize that cut. So we're going to heat up a needle here. And I'm going to dry out that tiny bit of blood that leaked. Just a tiny bit. You can barely see it. Just a tiny bit. The blood, it just barely leaked. Just the tiniest cut, we just have to dab it up. And once we dab it up, we're just gonna... Oh, see, I knew it. Hold still, hold still. Yeah, don't move. That was totally unbelievable that you did that. Yeah, are you okay? How could you move after having all that? We're gonna have to put a little more in here. Give me one more. Yeah, one more. Just give me one more. Okay. Let's do one more. There we go. Okay. You won't be able to move now. Let that take effect. Give me that hot needle. Okay, now we got this hot needle. You moved again. How are you doing this? Stay still, you little minx. There you are. Don't you dare move again. You're gonna hurt your eye. Heat the needle up here a little bit. Oh, it's hot. Okay, now we're just gonna touch this on the rim of this little needle is gonna touch it on the rim of the incision to stop any bleeding and tearing. Look at that. Perfect. That's it. You're done. We just gotta dry it out a little bit. We just gotta dry it. Just dab it off. I know we just added all that moisture, but now we have to dab it off. simple little eye test. I need you to look right at my nose. I just have to make sure that we've got what I need you to do is now follow my, look right at my nose. Tell me when you can't see this anymore. Good. Tell me when you can't see it anymore. Good. Good. Same. Don't move. Why are you moving? Stop moving. Don't look right at my nose. I'm telling you for the last time, that's gonna harm the surgery if you keep moving. Why do you keep moving? You're such an unruly patient today, shifting around, moving back and forth. Look right at the pen, my nose, with your eyes, nose, eyes. Tell me when you can't see it. Okay, tell me when you can't see it. Good. Now, you're not going to be happy until you hurt yourself. Now, I'm going to add a little bit of this oil. This viscous oil. This is a very viscous oil. I'm going to add it to your eye treatment. And then it's going to make you feel better. This oil will help seal up the incision mark. And then we have to take and put a little bit of burn. Wipe a little. There, it doesn't burn. Good. You're about done. How do you feel? I just want to look real close. Just want to look in there. See. That looks really good. The incision mark is perfectly healed already. Between the oils and the lotion and the moisture, it's totally healed up. It's already sealed the incision marks. And you can see where the incision marks have already closed. So, I would consider this surgery a success. Wouldn't you? Good. Now, you look perfect. Symmetrical. Your eyes look so anatomically correct. Balanced. Perfect. This was such an intimate, wonderful experience for me. I hope it was for you too. I hope you don't consider the violation of your personal space too much. Because I liked getting in close, personal, being so intimate with you, so claustrophobic, for lack of a better term. You know, we all must go on in life, no matter what life throws us. We all must go on. I'm trying to move forward just like all of you. It's not a journey that's over. It's not even a journey that's in the middle. It's a journey that just keeps going. Just keeps going. And we must never give up on the journey. Because that would mean giving up on ourselves. And I'm not willing to do that. Ever. Are you? I didn't think so. I didn't think you were ready to give up on anything. And I know things are difficult right now, but I haven't lost my faith in you. It's the only thing I have faith in this crazy mixed up world. The only thing I have faith in is you. You know why? Because you're real. And you matter. You've always mattered. And that's all that matters. Stay strong, my friends. Stay true. It's going to be a long, long spring and the summer, and we couldn't ask for more than we've been given right now. So take care and be proud of yourself. My name is Dr. Andrew Michaels, and I am here to help you always. most blessed day. Bye-bye.